this is our butterfly cannula. This is the hub of a vacutainer. These are the various vials. I am coming to the vials. Alcohol wipes. These are the various syringes. The volume of the syringe is according to the volume of the blood you need. Suppose you need only blood for only CBC or only fasting glucose, then you need a smaller syringe, and you have a lots of tests, then you need a bigger syringe. These are bandages or tapes. After taking out the blood, you need to secure the hemostasis, and then you will need this. And you need a requisition form where you have to fill in the details of the patients, the numbers of the containers, and if you have an automated system, you have to put the barcode here and the same barcode on the vials. The scanning machine will scan the barcode on the form and on the vial, and the result will automatically be given on the system. And you will need a tourniquet, and this is a container for the sharp wastes, that is these needles, and you will also, there will be also another container for these syringes. These are the things you need while you do a phlebotomy or blood collection from a patient, be it indoor, be it outdoor. Where from will you collect blood? You can collect blood from any superficial vein, but the preferred site is the median cubital vein. This is the preferred site. So why is this is the preferred site? Because this is a thick vein, you can see, and this is superficial. You can palpate the vein with your hands, and moreover in lean and thin and in muscular men you can also see this vein. In most of the men who are not like obese, you can see this vein. So it becomes very easy to collect blood from this vein. And if you are collecting blood in the ICU, so like if you have to collect blood from the vein, on the opposite hand where the patient in ICU is always having some intravenous fluid. So you have to collect the blood from the opposite hand. Where the IV cannulation is done, you have to collect blood from the opposite hand. In OPD patient, the question doesn't come. So the preferred site is this median cubital vein. So if it is asked which is the best vein for collection of blood or the vein of choice from collection of blood, you have to say it is the median cubital vein. Otherwise, any superficial vein, from any superficial vein you can collect the blood, but this is the vein of choice. So this is the form. First of all, you have to fill up this form. The form will contain patient's name, time and date, unique identification number. Every patient has got an identification number or registration number, something like that. Age, sex, the test, which tests are to be done, name of the doctor. Location means not that GPS location, where in which ward the patient is admitted, like the patient, if the patient is ICU, then it will be ICU, bed number, this and that. In this ward, in male ward, bed number, this and that. In surgical ward, bed number, this is the location of the patient. And along with the blood, you have to give a brief history of the patient. So this is the lab request form. You have to fill up the form meticulously so that the lab does not face any problem while dealing with the blood sample. Now this chart, you have to remember this chart. So what are the vials in this chart? First of all, this is sodium citrate vial. This is the sky blue or blue cap, and these are the blood culture vial. So these are the blood culture vials. These are like bottles, and these bottles contain the media in which the blood is poured, and if there is septicemia or something like that, the bacteria will grow in this bottle. And this is the citrate vial. This contains sodium citrate. Okay, and these are the tests which is done from vial, from blood collected in this vial. Okay, and every vial has a mark, a black mark or a black arrow, and you have to fill the vial up to that mark only. If you take less blood, there will be a discrepancy between the amount of anticoagulant and blood, and if you take more blood, it will be the same case. This red cap, this is the clot vial. This does not contain any anticoagulant, and this blood has got no mark, and you can fill it, like whatever amount of blood is left, you can fill it up to that. Here you will centrifuge the blood will get clotted, you will centrifuge, and you will extract the serum, and all the tests which require serum is done from this blood. Okay, this is the gel clot vial. From here all the hormone studies are done. This green is the heparin vial. These tests are done from the heparin vial. This lavender vial is the EDTA vial. From EDTA vial, the most common test is CBC, complete hemogram or complete blood count. Others is HbA1c, MPDA, TROP-T. All these tests are done from EDTA vial. This is not very commonly used. This is used mostly in the blood bank. This is a pink capped vial, and this is used for blood grouping and cross matching. And this is a grey capped vial. This contains fluoride vial. This is used for estimation of blood glucose. Okay, so these are the colored caps, and this is universal. Everywhere you will get the same colored caps for the same anticoagulant or no anticoagulant, and the same tests are done from the same colored vials. This is universal color coding. Everywhere you go, you will get the same thing. So there are some rules, like people will come and ask, will I have to stay for empty stomach for giving thyroid hormone, for giving LFT? So there is not any specific regulation about that, but if you give a fasting glucose, then you have to stay fasting for approximately 8 to 12 hours. And if you give a postprandial glucose sample, you will have to give give your blood 2 hours after a major meal. And this 12 hours is also applicable in case of lipid profile. In case of lipid profile, you have to give a 12 hours fasting time before you collect the blood. Otherwise, everything can be done whether you eat or not, that doesn't matter except for these tests. Fasting glucose and lipid profile, you have to stay 8 to 12 hours of fasting, and in case of postprandial glucose, you have to eat, and then after 2 hours of eating you have to give the sample. And others are random blood sample, you can give sample irrespective of your meal. Clear? Everything is clear up to this? This is the norm that is followed everywhere. In every hospital this norm is followed. These things I have already showed you. This is your yellow cap, gel and clot activated tube. This is all English and nothing. This is a plain tube. Plain tube means this is a clot vial. This has got no additive. Okay. Rest is English. These things are too much technical. This will not be asked in the exam. This is PT tube or citrate tube. Okay. This is EDTA tube. It will be asked what EDTA is used. Potassium EDTA is used, not sodium EDTA. Potassium EDTA is used as the anticoagulant. And in that chart it is mentioned what tests are done from which tube. Just if you go through that chart, everything will be clear. And gray tube, I told you, sugar. There is also a black tube which we rarely used. This is for ESR estimation. This is gray and this is black. This black tube is used for ESR estimation. This contains 3.8% sodium citrate. This is also rarely used. So now how things go wrong? Improper filling of the samples. Improper vial used for a particular sample. Improper quantity of a sample for a particular test. So, improper filling of samples. That means the sample the vial which has to be filled first is getting filled last. So, if you do that, then the result will not be correct, you will get an improper result. Improper vial used for a particular test. If you used EDTA vial for testing sugar, obviously the value will not be correct. And improper quantity, I told you there is a mark in the vial. Up to that mark you have to take the blood. If you take more or less, there will be alteration in the anticoagulant is to blood ratio and the result will not be authentic. So that is improper quantity. Now order of draw. This is very important. You have been given, there is a patient admitted in ICU, you have been given different kinds of tests. So in what order you will draw blood from the patient? The first thing you have to do, you draw the blood, the first thing you have to do is put the blood in the blood culture bottle. First it has to be given in the blood culture bottle because there is no scope of contamination in case of blood culture. Then you have to give in the sodium citrate or this sky blue, Protham in time, Protham PT APTT vial. Next you have to give to the clot vial. Then if there is heparin vial, then you have to give it to the heparin vial. If there is no heparin vial, then you have to give the blood straight to the EDTA vial and then to the fluoride vial. This is the order of draw. In this order, you have to put the blood in the vial and next comes the other. Now you might ask that if I give citrate, then clot, then I come to EDTA, will not the blood clot? You have to do it rapidly. But if I give the first blood culture is gone, I have to give the blood absolutely in sterile condition. Then if I give the blood to the EDTA vial, there is a chance of contamination, and then I am giving it to the clot vial. From clot vial, what we do sodium potassium. There has been a request for sodium potassium test. There is Potassium EDTA. So when I am doing a sodium potassium test from this clot vial, from this serum, the serum gets contaminated with the potassium from the EDTA vial, and we get a falsely high result of potassium. Even in our daily practice, when the order of draw is not followed, sometimes we see in the sodium potassium test 75 milligram sodium. What is this? The normal level of sodium is 3.5 to 5.5. So what is this 75 gram sodium? Is the person at all alive? Then we found that the person who has drawn the blood has not followed this order. He has contaminated EDTA with this clot vial. That's why you take citrate, then you give it to serum. Red. Then you come to EDTA and then to fluoride. So this is the order of draw. You have to maintain this order of draw whenever you are given the task of drawing blood. So I don't know who draws the blood here in the hospital, but in our hospital where I worked as intern, we interns used to draw the blood, and we used to follow this method. Sisters used to say that this patient needs this investigation. They used to hand over the files to us, and we used to do all these things: blood drawing, collection, then labeling, sending it to the lab. We used to do all these things, hand over to the GDA, all these, the requisitions, the samples. We used to do everything. So this is very necessary, and if you by chance do any mistake in this, you will get hilarious results. And labeling should be proper. There is Mr. X and Mr. Y. Mr. X is a CKD patient. He has got 137 urea and 9 creatinine. And Mr. Y is a normal patient. His urea creatinines are normal. You do an improper labeling, and suddenly Mr. Y becomes a CKD patient and Mr. X becomes normal. That will be the condition. So you have to do a proper labeling and proper identification. Sometimes there are changes in beds. A patient who is in bed number 1, maybe due to some condition, he has been shifted to bed number 5. You have to identify patient. Today who is in bed number 1, tomorrow he may be shifted to bed number 5. You have to do the identification. So don't always rely on the bed number. You ask the name of the patient. See his registration number. Then only proceed for the blood drawing. You have to process the blood. You have to mix the blood properly. You don't need to shake this much. These will break down the RBCs, and you will get a hemolyzed serum. You have to mix it. You have to hold the sample like this. You have to mix it like this. And all this problem goes out with the vacutainer. The vacutainer is a very convenient thing, and it is a very advanced thing. Once you use the vacutainer, nothing is required. And the vacutainer also gives very perfect result. Transport of the sample is very important. Even if you draw your blood in a vacutainer, it has to be transported in a proper way. here if you go to the hospital, you will see there are blue boxes, small boxes, and there is ice inside, ice pack, and there they keep the blood vials. The blue boxes are for normal patients, and there are red boxes which are for seropositive patients, positive for HIV, HBsAg or HCV. For them there are red boxes and you will see that biohazard symbol is there. So in those boxes, blood is transported from the ward to the lab or like that. This transport is very important because you just carry the vial in your hand in the scorching summer in Birbhum. There will obviously the quality of blood will deteriorate. And timely, when you collect the blood, it is expected that you will send the blood to the lab by half an hour. Otherwise, you will leave the blood will be there, the blood will start degrading. So, you will get the results which are not appropriate. And these will cause massive analytical error, incorrect reporting, and obviously bad reputation. Okay, so what you have to do, name, surname, registration number. These are all necessary for the identification of the patient. Don't rely on the bed number. Patient's name, surname and registration number. Suppose Vikas, there may be 2-3 Vikas in the same ward. You have to confirm the name, surname and the registration number so that you can identify between the 3 Vikas. And this registration number is unique to everyone because the 3 Vikas will not have the same registration number. This you have to ensure, and then you have to mix the sample properly, and then you have to send it to the lab, preferably within half an hour of collecting the blood. So, this is all about blood collection. Anything else you want to know? Any doubt? In exam, what you have to do is, the vials will be there. You will be handed over a vial and you will be asked about what is this vial. You have to name the vial. What are the tests done? You have to name the tests which is done from the blood in the vial. What is the anticoagulant used in the vial? You have to name the anticoagulant. These all will be asked. So, that chart is very important. What are the tests done from which color of the vial? The color of the cap is very important.